My name is Muhammad Haziq bin Hasnul Ash'ari. My metric number 1200143. The background of Mr. Muhammad Shahlan. He is a psychology officer at Department of Social Welfare Malaysia (JKM) at Besut, Terengganu. For her education background, he was a student of matriculation program of Human Science of International Islamic University Malaysia at IUM. Next, he continued his study in Bachelor of Human Science in Psychology with Honours at the same university, and then he continued his Master of Science Counselling at Northern University of Malaysia UUM Sintok, Kedah. And now, he currently enrolled as a Ptsd counselling student at University Utara Malaysia. Actually, Mr. Muhammad Shahlan more interested in the clinical psychology under Ministry of Health of Malaysia (TKM). However, now he working under Social Welfare Department (JKM), which emphasize the field of counselling psychology. Mr. Muhammad Shahlan has handled a PTSD case. Most PTSD cases effect of various forms of accident or unfortunate event involving crisis and disaster, as well as some event or crisis situation experienced prolonged. The case involved the group consists of various levels of people who frequently visit his department, including disaster victims. The various issues faced in crisis and victims of domestic violence among some group of clients who frequently show symptoms of PTSD.
What is PTSD? PTSD is a specific tendency to publish a sense of emotional tension in response to a variety of feeling fear. For example, fear, despair, and horrific experience that affect prolonged exposure to threat, nor the actual situation in respect of death or accident, serious injury may contribute to this situation. This emotional stress tension usually appear when the client recalls the situation to which he was exposed to a real threat situation. Reaction that can identify may be seen from psychological reaction, either external or internal trigger that may be related to the such as traumatic event. It can also appear through memory and shadow, suddenly remember, recall, and can also appear in the form of dream nor perception in the client cognition. How to identify someone has this disease and what are its characteristics? Clients tend to have symptoms of PTSD, usually often behaving and having feeling as if it were an event regarding past experience recurring in their life. In the session of the meeting, the client found it difficult to detail with clearly the traumatic aspect experienced. For some cases, clients are found to be emphasized from discussing, nor is it directly or indirectly involved in any aspect, event, activity, place of or individual, which is on prudence clients in relation to the traumatic incidents experienced. In some cases, there are clients who decide not to directly discuss or continue refrain from sharing any view, though feeling or conversation related to the event when invited by the counselor to do so.
Next, PTSD starts at what age? Tendency to PTSD not subject or bound to any age limit. In fact, it can be experienced by individuals throughout the developmental or organizational stages of the client's life. There are probabilities for each stage of growth will be showing different reactions and sometimes the same depending on the uniqueness of the individual confronting the issue itself. For example, just like Mr. Sahlan's client life, a man who showed lack of interest in significant activities, emotional numbness, and inability to fully display emotions, including feelings of affection there, and the rest began to be markedly pessimistic in life. Some of Mr. Sahlan's clients also showed signs of exile or isolation from a group that are significant to them, sleep disturbances, numbness, and lack of concentration. In more challenging cases, clients begin to show a tendency of interest related to the abuse of alcohol or illicit substances. Research has shown that post-crisis children are more prone to irritability and rage. For female clients, girls and women Tepper emphasizes group certain ages often show guilt and signs of depression, want to commit suicide and often think about death, including grieving symptoms.
What is the factor of contributing to PTSD? Basically, there are many factors that contribute of occurrence of PTSD. Most of the clients usually faces issue concern pressing, or perhaps like the clients has ever experienced traumatic experiences during the early stages of lifespan development. For example, have been involved in abuse either physically, emotionally, and sexually when they were a child. For adult individuals, such as army retirees, for example, often tends toward PTSD symptoms. This is because of the challenge of the profession involving regional security mission, for example, capable of making impact lasting until it leads to PTSD. Having acquired disability as a result of an accident and carrying permanent disability and dysfunction, up to debilitating and chronic sick disease. Between several causes of clients tend to have PTSD symptoms. In addition to situation unexpected, sudden tragedy, which is we are all well aware. PTSD also come in the form of inheriting a mental related illness from a family members, such as a history of family members experiencing depression, anxiety, and significant stress in addition to personality disorder. There are also tragedies and internal conflicts of the family, removing the client from contact with families, which is a cut ties, also leads to PTSD symptoms if left unchecked. The rest of the natural disaster, armed threats, or being injured, serious abuse. For cases teenagers are usually bullying that serious in what happened right now.
Okay, my name is Muhammad Adan Najat bin Muhammad Nasir. My number matric is 1200146. Okay, let's continue to the next question. What is a common treatment has used to approach use when dealing with PTSD patient? Okay, he continue to focus how he as a counselor want to dealing with client who have a symptom of PTSD. The goal of his season, he usually categorized into two, namely short term and long term. For generally, to the most client in PJ is to want to reduce the frequency of symptom, in turning minimizing the negative impact of traumatic event on aspect of life of client. In addition, he have a client to build appropriate mechanism within adapting one ability to current issue that the client is facing. The image destructive can minimize client and transform destructive behavior to his constructive behavior and to promote healing, treatment, acceptance, and accountability of client. In the meantime, for the short-term goal, on the other hand, is to identify by filtering as well as determine history and nature symptom. that the client is experiencing. This can be done by building rapport, therapeutic, and access the client history in terms of frequency, intensive, duration, time, and impact, and other background of the symptom encountered. During the season exploration, if most the symptoms are significant and relevant, the client is advised and bring to discuss how advanced screening tests and testing psychology by the point the curtain concern has carried out can help client to determine the seriousness of the client issue. If the client agrees, okay, the client will refer to the relevant unit with the client concern. If the client does not agree, the client is recommended to continue the counselling season in stage and sparkling who can he treat the client. Start listing the trigger of the picture and the client's mind about the facts and anything closely related to the traumatic insight at the time. It is implemented with great care because of the aspect of vulnerability of fragile client are highly emphasized. If approved, the client is also encouraged to meet with a psychiatrist to identify the overall condition of the aspect physical client, right? Check for any suicidal institution, sign of depression and other potential that are capable of having a negative impact on the client as a measure vigilance in follow-up season. He also checked the history of alcohol or prohibit sustained use through a self-screening form using the method of brief family tree back measure of family's mental health history. If the client taking a certain prescription, clients are encouraged to share in the season. Okay. Season group of counselling, PFA, and debriefing something what he also used for medium scale traumatic event. Psycho-educational program are used for large scale issue. In psycho-educational program, it's like to coping mechanism, cognitive, restrictive, systematic, desensitization, and measure other are disclosed for client to gain a core understand before discussing with their respective nurse. Okay, next, he said out of season assignment are usually development with set of relevant reading material, logbook and record including journal and diaries involve emotional cognitive behavior including sleep pattern, periodic report of audio recording to the WhatsApp application is also used. Okay, the issue of relapse was also described before terminating back member understanding that the client is open to contact counselor at the client comfort when in need. Family counselling as well encouraged according to the client willingness in addition to couple marriage counselling for the next case of king especially. Okay.
Conclusion, the DSM-5 that Dr. Salan refers to is able to provide guidelines for identification symptoms, overall condition, and age while differentiating to screening symptoms for other disorders. Not to be one fault to us in the field of counseling familiarity with the DSM, so that the counselor is the same leader in the relief work can identify, analyze, classify, and see tendencies. From understanding limitation and recognizing distinctive boundaries are capable of smoothing interrelationship, profession and business mobilization, including integrating of expertise in existing with issues facing clients. Dr. Salan recommends young people and students to start taming DSM and so many screening instruments in the clinical science of psychology for adding value to existing expertise. It is also important to ensure knowledge transfer from one generation to the next is not delayed and disconnected. Mr. Salan and his classmates will retire at any time. Until then, they expect the support of us to continue the legacy that Dr. Sahlan left behind in acting as human engineers for the sake of what more to come. Dr. Sahlan apologized for the inconvenience that arose as a result of his unpreparedness for a live interview and chose to conduct hybrid interviews because of certain constraints that he could not avoid. Dr. Sahlan once said, "The beautiful and the real is mine. What's wrong and superficial is my own weakness." That's all from us. Thank you.